It was not a case of deciding whether her pain was structural or metabolic. It was both, and possibly nervous system and emotional too. And I think this is where people often get trapped. They're told it's your posture, or it's your diet, or it's stress, or it's your spine, or it's your nervous system. But very often, persistent pain is not caused by one isolated factor. It's the interaction between factors. For Amelia, there were structural issues that needed attention. Her body needed better support, better stability, better coordination, and better movement efficiency. But there were also digestive and metabolic issues that appeared to be affecting her energy, comfort, inflammation, and overall resilience. So the work became more comprehensive. We were not choosing between the body structure and the body's chemistry. We were supporting both. And when both improved, her overall experience changed. That is the whole person model in action. I think one of the most important takeaways from Amelia's story is that recovery often comes from stacking supportive influences. People understandably want to know, what was the thing that worked? Was it the exercise? Was it the new chiropractic adjustments? Was it the nutrition? Was it reducing refined carbohydrates? Was it improving digestion? Was it feeling more confident? And the honest answer is that it was probably a combination of all of them. That is not always exciting as saying, here is one magic thing that did the trick. But it's much more realistic. When several stressors are feeding into the pain experience, several supportive changes may be needed to shift the system. One change may reduce mechanical strain. Another may improve energy. Another may calm digestion. Another may reduce inflammation. Another may increase confidence. Another may help the person move better. And together, those changes can alter the trajectory. So Amelia's story is not a story about a miracle technique. It's a story about looking more broadly, asking better questions, and supporting the body from more than one direction. That is exactly why I wrote Beyond the Pain. As you listen to Amelia's story, you might ask yourself, have I been looking at my pain as one isolated body part problem, or could there be a wider pattern influencing it? When I first started working with people in pain, like many practitioners, I was very focused on the physical body. And to be clear, I still think the physical body matters enormously. Biomechanics matters, posture matters, movement quality matters, strength matters, tissue health matters, breathing mechanics matter. The way someone loads their joints, their spine, their muscles and connective tissues matters. I do not want this episode to sound as though I've moved away from the body. I have not. But what changed over the years was that I began to see that the body is not separate from the rest of the person. If this sparks something for you, there's a much deeper conversation in the full episode. You can watch it here on YouTube or on Spotify, or listen on Apple Podcasts. Like, subscribe, and stay connected for more.